have approximately 30 minutes, one question, one follow-up. Today we have Dr. Williams and Dr. Yaffe here today, so I'll turn it over to them for some brief remarks.
Yes, good afternoon, and lots of good data inputs for today that Dr. Yaffe will go through. You've heard already the announcement that I had recommended and we agreed that we would move into step 1 this Friday coming up, and I'll have some more comments to make about that in a moment. So let's look at these data points right now to see where we are in the descent on wave 3 and how well everybody's doing in different regards and different aspects of the data. So I'm going to hand things over to Dr. Yaffe for an update on the data points over the weekend, and we can talk about later what we do with the week ahead. Over to you, Dr. Yaffe.
Thanks very much, and good afternoon, everyone. So since the last update we provided on Thursday, Ontario has reported an additional 2,846 cases of COVID-19. That was 914 cases on Friday, 744 cases on Saturday, 663 cases on Sunday, and 525 cases today. This is actually the lowest daily case count that we've had since September 27th, 2020. Our 7-day average for daily new cases is 735, and that is significantly down from 1,078 cases just a week ago. Sadly, we are reporting an additional 68 deaths since Thursday's update. This includes 15 COVID-19 related deaths today, bringing the 7-day average to 16, which is slightly less than the 19 last week. We extend our deepest sympathies to the families, friends, and caregivers of those who have passed away from COVID-19, and to everyone mourning the death of a loved one. While the number of hospitalizations and ICU patients does remain high, the numbers are continuing to show steady improvement. Today, there are 547 people in hospital, although this is underreported, as we know not all the hospitals report on the weekend. The number of Ontarians that are in ICU, reported by the ministry today, is 466. We also know that we have 31 people from Manitoba in ICU in Ontario, which brings our total to 497. In terms of testing, 15,177 tests were processed yesterday, with a positivity rate of 3.6%. The current 7-day average for percent positivity is 3.1%, and that is down from last week's 4.7% positivity. So as you can see, our daily case numbers, case rates, and hospitalizations are all going down. And the number of vaccines being given continues to increase. To date, more than 10.1 million doses of COVID-19 vaccine have been administered in Ontario, with over 1 million Ontarians fully vaccinated. These are tremendous milestones, and every person who's been vaccinated makes us all a little safer. And starting today, everyone in Ontario who is age 70 and older, as well as those who received their first dose of the vaccine on or before April 18th, are eligible to schedule an appointment to receive their second dose at a mass immunization clinic through the province's booking system. I do want to encourage all Ontarians to get vaccinated as soon as you can, and to receive your second dose as soon as you are eligible, in order to ensure maximum protection against COVID-19. And with that, I'm going to turn it back over to Dr. Williams for some additional remarks.
Thank you, Dr. Yaffe. Overall, the situation in Ontario is steadily improving. And this has been a good direction over the last number of weeks, and we're seeing the fruits of the activity, both of the vaccinations, first dose and now second dose, as well as people continually adhering to public health measures and to be careful and cautious. So thank you for your part in this. And you saw we had a slight bump last week. As I said, we were worried about a couple of things. One is the impact of the Victoria Day weekend, and that seems to have been minimal. As well as we're concerned about the new variant, the Delta, or the so-called Indian variant, the 617.2 in particular. And it seems that our vaccination program has been able to temper both those. That's encouraging. We still want to watch that and monitor that. So the provincial rate has decreased by 34%, down to, and this is late last week, 40.4 cases per 100,000. If you remember the old framework, that's below, just about at the edge of red going into orange. And I'm sure our updates this week already will be below that. The effective reproductive number that we talked about trying to get it, even the modeling, down to below 0.9 is actually at 0.78. This is a terrific gain as the amount of transmission has been reduced dramatically throughout. And we see some of the areas that have been traditionally high getting down below actually 100 cases in a day, such as a recent one from large ones like York Region and Peel as well, with our smaller volumes. So this is a terrific achievement. Our hospitalizations has also continued to decrease, in spite of the fact we've heard concerns that the Delta was very much widespread and prevalent and moving around, especially areas of Peel and through Toronto. As of yet, we have not seen this increase in the hospitalizations. That is an encouraging direction. And it tells us again that our hard effort to vaccinate the high-risk areas has given extra dividends and given the support that while it may have transmission increase issues, it doesn't have, so far, evidence of severity. But I want to be cautious because those severity issues are often late and take a while to be seen. As Dr. Yaffe indicated, our immunizations have trended upwards since we have surpassed the 60% of adults getting their first dose of the vaccine, and we're heading beyond 70% as we really are pleased with the people coming out. We still want those who have not had a first dose, who've had concerns or issues about booking, supplying that. We still need to see you come out. We still need those 13 or 12 to 17-year-olds. We still need more of the younger adults to come out. And in some areas, we have some individuals who are over the age of 80 and over the age of 70 has still not come out for a first dose. You can see how protective it is, and the safety has been, again, demonstrated in the overall numbers. So if you still haven't had a first dose, we want you to come out and get that first dose. Family members, to encourage those to come out and get their first dose in that process. And as you've heard, we've opened up more for the second dose with the 70 above today, and we understand the amount of people booking actually in some locations overload the system temporarily. I think while that is frustrating for some, it's a great message because some said if they waited for a bit, they got back on and were able to book in a very timely way. So we've moved that time up where you were supposed to get your second dose later on into July and August up till now. This is the progress we're making as we continue to move forward. And we're hoping that with other age groups, we might be able to move that and shorten that timeline up further. So while we're doing this, we still don't want to be complacent. As we're going into step one on Friday at midnight, 12:01. This means there's more outdoor activities being promoted and elaborated on, such as patio dining with 4 people who are not in your household. And you can have a larger number of your household members at a table. If you have a big family, you can do so. And there's many others that we've announced in our press release that are being undertaken at this time. So while we're opening up more and more things, which is only but to be expected, as you have done a great job of doing what you need to do, vaccinating, keeping public health measures, and bringing those numbers down, we still have to be cautious because we haven't yet achieved our other goals of high numbers of second or people with 2 doses of vaccines in there. But even today, we're making great strides in that matter, and we hope to push that percent up higher and higher as the week goes on and the weeks ahead. So we're watching our numbers. We think that this week we'll be down below the 500 level, and that's where we'd hope to be. We hope our ICU numbers will be down to the low 400s, maybe with Manitoba patients permitting. We might be close to 400, just dipping under 400. This is all good aspects, as we have in the hospital started to research up again our elective surgery. And they're starting to do the diagnostic processes and others to get prepared for that. That's also good news for those who have waited, some with concern and issues, to get seen as soon as possible and to start back to make up that backlog in that process. So if we continue to be doing what we're doing, if we're continuing to get vaccinated, being careful, we're into the step 1. Step 2 is not that far away. 3 weeks goes by pretty fast, and we hope to proceed in that. Even more opens up in step 2 and then further on to step 3. All moving to getting back to a summer that is more like what you're used to having in a summer, but a safe summer, not one where we would open up and then close back down again. We really do not want to see that happen. You don't want to see that happen, and neither does our government want to see that happen. So thank you for what you're doing. Continue the good work, continue to get vaccinated, and let's together come down not only off this third wave, let's come right down and keep the rates low from now on related to anything with the pandemic and the way forward. So thank you, and now I'll hand things over to the media for questions.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question, please.
Rob Ferguson, Toronto Star.
Hi, Doctor. Just wondering, so what do you expect to happen with case numbers and infection levels once we reopen? What is the reasonable expectation? Do you think we'll be able to keep declining? Or with this Delta variant being more contagious, do you think that we might hold the line or even go up a bit?
So thank you for that question, Rob. And as we're seeing here, we expected, as we were getting information from our public health laboratory, that in some cases the variant had been circulating, the Delta that is, fairly widely in some areas such as Peel and parts of Toronto, already up to, by the middle of May, 30% of the cases were identified potentially, and that was increasing. So we thought if we're going to see some indications of increased transmission, hospitalizations, ICU admissions, or deaths, we would start to see it, and we haven't yet. So that is encouraging. I think with our levels of vaccination of first dose moving, especially in Peel and Toronto, well above 70%, heading up to 75%, York Region already above 75%, a terrific work done in all these areas, and especially in those high-risk areas that were identified before. It is my hope that as we go through this phase and continue to stalwartly move ahead with our vaccination, getting our second dose rate up as quickly as possible, and we may move pretty quickly on that, that the rates will continue to decline. And so I'm hoping that in the next few weeks, we will see our case numbers drop below 500 a day, down below 400 a day. And I'd like to see that continuing down. With the summer weather and other things coming, remember way back last summer in August, we were talking about numbers of 60 to 80 cases in a day for the whole province. I think we can see that again. But we are now at vaccination, not just coming down off a wave and with the summer weather. So this has all the potential of driving this right down to very low levels. And that's what I'd like to see in the future together as we take time to move through the steps and allow immunization to build up effect in the public and to bring that down.
Follow-up?
Yes, thanks, Doctor. Just more on Delta. Where exactly is it? Can you pinpoint some of the places in Toronto, Peel? I believe it's also in Waterloo. I don't know if it's part of the problem in Porcupine, but can you give us some more specifics on where it is?
I assume you mean, Rob, where the variant is, the Delta. And we are seeing it in various parts of Ontario. I know Dr. Yaffe may have a comment to make about it. We've had an outbreak that was outside our jurisdiction that has dispersed a number of these cases around to many of our health units. So I'd be very surprised, and maybe Dr. Yaffe could comment on that, if there are any health units that have not seen a case of the Delta variant at this stage. The ones we're seeing and more involved in, as I said, were Peel and Toronto, plus some of the other GTHA health units around, and Waterloo correctly, and also in Porcupine has seen it as well. So just because you're in a remote area doesn't mean that you're not open to being contacted with a variant, and whether Dr. Yaffe wants to comment on that, because he's been doing the outbreak investigations, especially related to the Delta variant.
Sure, thanks. I think it's fair to say that Delta strain will become the predominant strain in Ontario, just as it has happened in other jurisdictions, particularly the UK. And it's just like what happened with the P117 or It's currently called the Alpha, but the one that was originally identified in the UK. When these new strains come that are more highly infectious, more transmissible, they do tend to become predominant. And I believe we've had it now in pretty much every health unit, including some outbreaks even in long-term care facilities where people have been immunized, although they luckily have much less serious infections. I think what's important to know is that if you're vaccinated, particularly if you've had 2 doses, you are very well protected against the Delta strain, particularly with the mRNA vaccine. So the more people are protected, the less the strain can spread. And it doesn't matter, it's very transmissible. If we're vaccinated and we use good infection prevention and control, we will be able to blunt its spread.
Next question.
John McGrath, GVO.
Good afternoon, doctors. I guess related to the question of Delta, I know some jurisdictions have opted to shorten the dose interval for people who received a first dose of AstraZeneca. Ontario is currently sticking to 12 weeks. Is there any discussion of moving that to 10 or 8 weeks even?
We know from the clinical trials and the effectiveness data from other jurisdictions that the maximal protection is effected if you have a 12-week interval between the first and second doses. Now, of course, that's competing with potential exposure in the interim. But at this point, we're pretty much, I think, saying ideally 12 weeks between doses. We are also saying people who have had AstraZeneca as their first dose have the choice of getting an mRNA vaccine like Pfizer or Moderna as a second dose if they wish.
So, John, just to make it clear, Dr. Yaffe is talking about the time interval between the first and second dose of AstraZeneca being optimal at 12 weeks, and then added the extra comments in there, just to be clear.
Follow-up?
Right, thank you for that. On a separate issue, the Minister of Health said today that the government is not considering a second round of hotspot strategy for dose allocations. But given how many people in the hotspots got their first doses during that 2-3 week window in early May when we were doing the hotspot strategy, if we keep rolling eligibility forward by the date of the first dose, is this not going to create chaos in places like Peel and Toronto where huge numbers of people are going to become eligible for a second dose? But if we stick to the per capita allocations through public health units, those doses just are not going to be there for several weeks, if not longer.
So I'm not sure exactly the minister said we're not looking at hotspots. We'll continue to try and assess that. It's interesting, some of the ones that were high before are not that high anymore. I think because they moved on them fairly quickly back in the past. Our supply is such now that a number of those health units are being challenged to keep up the dosage to use up what they have, and we have more coming. So it's our supply has really improved and will improve over the next few weeks. We hear we're getting some other supplies as well. So I think it's full force ahead in all areas in that. So I really don't think there's going to be a shortage on the matter. We do want to make sure that we do it in a timely and an orderly way. And of course, some of those in those other hot spots were vaccinated a bit more earlier than some others. And there's some parts of the provinces where, and some of the more rural areas where we want them picking up the vaccine rate to get their rates even up further. So it's a team effort of moving all the yardsticks up in there. But if there are some areas that we're concerned about that it seems to be more, we will allocate and make sure they have enough. But the main challenge we have is to make sure that the areas can, whatever they've got, they keep putting in arms and keep it moving forward at still in an orderly way so we can document everything through the COVAX system. So we are satisfied right now that our supply is meeting that demand. And in fact, it's fairly good. So we're working full steam ahead. Where they want to do priorities, we'll work at those as well.
Next question.
Jeff Gray, Globe and Mail.
Well, thanks very much. I just wanted to ask about Porcupine and how concerned you are, what efforts are being made. Obviously, the medical officer of health there has said that they need to stay in a more of a lockdown situation. Can you tell us a little more about what's happening in Porcupine and what the outlook is?
Let me ask Dr. Yaffe to give you an update on just in general all the things that they're doing, working with Porcupine over the last while on dealing with a large number of cases they've been experiencing and the assistance we're giving them. Then I'll make a comment about how it relates to the steps.
Yeah, thanks. We've certainly, I've been in touch with the medical officer of health for Porcupine. Staff are working with them. In fact, I think they're having a call as we speak. We are doing a number of things working in collaboration. We are providing support around case and contact management from the provincial workforce. We've sent them extra vaccine for them to vaccinate, offer vaccine to the people in the communities. We have been working with them, in particularly as they declare emergencies in some of the facilities or some of the cities or regions to fund isolation centers and make sure that people are properly isolated. So it's a full-on effort, and we know that what we're learning is that it's affecting particularly vulnerable populations, homeless, underhoused people, people who are mobile, people who are going between different communities. And so part of it is trying to get people to stay in one place and get tested and isolated if appropriate, get the contacts and so on. So it's a full-on effort. People are getting vaccinated, and we are working hard. It's pretty much similar to what happened in Thunder Bay a while ago, and we're confident they will get it under control. It just takes time.
And I think I would add that, as I said, we're having a phone call with Dr. Catlin, the MOH, and they've been working full out. So it's a lot of work for a health unit that size, and we're using our central case contact management staff to support and help them in any way we can. More vaccine has been given out, and they have a very good vaccine uptake at the same time, but it does take 2 or 3 weeks for that effectiveness to impact itself. At the same time, both myself and Dr. Catlin would agree, come this Friday, they're not in any way ready to open up into step one, the only jurisdiction. And I understand that, and while that's, the timing is unfortunate, so we're going to work out what's best to deal with that and maybe postpone some of those aspects there so allow them a chance to recover and hopefully get their area to open up as soon as possible. And remember, some of the numbers that are contributing to their health units total also come from some of the First Nation communities that are in this jurisdiction. And we're working with counterparts in First Nation Inuit Health Branch at the federal level, as well as with other self-government health authorities and our Operation Health remote immunity to see what we can do to help and assist those communities as they're dealing with some impacts in their respective jurisdictions to help them to get their communities safe and under control. So everything's working on all fronts, and hopefully we might see those numbers. They dipped a little bit. I'd like to see them come down even more as the week goes on.
Follow up?
Okay, thank you for that. Yeah, and just two points to clarify on these two things. One is would the delay to things in Porcupine take the form of a Section 22 order, or would it be something the province would do? That's one point of clarification. If I can squeeze in a second one is, I think what you said earlier about hotspots, Dr. Williams, is you might still allocate more to hotspots if it becomes necessary, but it's not necessary now. So those 2 points, if you just clarify those two.
Yeah, so how to do that, Section 22 is usually specific in some areas. You might have to write a number of them. And we're trying to explore how I can help and assist in that way through my powers. We both want to do the same thing. And so we're having a meeting to discuss that right now, and we hope to have some resolution that is conducive to both settings, because we only want what's best and to bring it under control. As far as the hotspots, if there's areas where we need to move more, as we're moving more vaccine up to Porcupine, we have some others we're concerned about, seeing their numbers still edging up, and we want to say what's going on. Do we have to help them a bit more, especially if what they have in store and the fridges and that is not adequate? How we help their pharmacies get on board more, how we make sure the health unit, the mass clinics, sometimes community pop-ups are necessary. So all things are on possible if we need to do it, and we're prepared to take action if we need to.
Last question.
Matthew Bingley, Global News.
Hi, doctors. I'm wondering, when it comes to moving into
step 2. Obviously, we're moving into step 1 a little bit early. Would you recommend, if we see the right markers and vaccinations really take off, that there's a possibility that it may be able to happen earlier than that 21-day target?
Well, everybody's eager to keep moving quickly. I think the fact that we're opening up on the 11th as compared to the 14th, a few days, because our data and that moved in the right direction. We'll continue to review those data points and to assess it. The 21 was to allow, of course, for the vaccination and the numbers to settle. Instead, we don't want to be going to step 2 and say, oops, let's go back to step 1. We don't want to do that kind of process. If we go to step 1 and then to step 2, we don't want to go back to step 1. So we want to make sure we're really satisfied that that trend direction, as we are now, we know the trend direction is moving in the right way. And I mean, we're always prepared if all of a sudden the numbers imploded, we would pull back on the decision on Friday, but we see nothing that tells us that we can't open up on Friday in step 1 because we have been careful and slow. And we want to do the same thing with step 2. So we'll have to continue to look at that and review the matter. But our model right now is to look at those 3-week period between the steps in order to ensure a steady trend direction that we're satisfied will not just rebound back up again. And we did that this time, and we did see that the surge over Victoria weekend did not occur. Neither did the impact so far of the Delta, but we continue to watch it and monitor it very carefully. So stay tuned.
I wonder if I could just
Please
add to that. Thank you. I just want to reiterate, one of the main indicators we're looking at for going from one step to another is the vaccination rate. And if you get vaccinated today, it takes at least 2 weeks, sometimes 3 weeks or more, before your body has developed the protection from the vaccine. So that is part of the rationale for the 21 days. So yes, it's great that everybody's vaccinated today, but we need to give their bodies time to develop the protection so that they're protected. That's part of the reason for the 21 days.
Follow up, and this is the last question.
Yeah, I just want to follow up on the hotspot questions that have already been asked, and I'm wondering, of the people that are currently being infected still in the bulk of the cases, I'm wondering if you could just break it down for really who is getting infected here. Are these people who are vaccine hesitant? Are they essential workers? Could you just provide a little bit more clarity on where these cases are primarily popping up?
And that is a very good question. We're asking for some data from our Ontario Health people because our better metric is who's getting hospitalized at this time, especially in our previous hotspot areas. And so far, a lot of our hospitalizations are people that have been unvaccinated, which is unfortunate. And even when there was time for them to get vaccinated, some people with just one dose, and of course, as Dr. Yaffe has just alluded to, the fact you got vaccinated and 4 or 5 days later get COVID, you really haven't built up any immunity at that stage. So we'd call that basically an unvaccinated person at that time, even though they had the procedure, they still have mounted immunity. So it seems the data to us still indicates that by far, the majority of the people ending up in the hospital or the ICU have been individuals who either haven't or chose not to get vaccinated. And that's besides where they might have come from. A lot of our essential businesses, we have gone through programs, especially in those hot zones, to carry out pop-up and with workplace-orientated vaccination clinics. A lot of them over the last month, and that has been very valuable. We've done a lot of cultural community settings, whether in various temples, church settings, and other ones, and we just want to reach everybody we can. So unfortunately, we'll continue to monitor that data, especially the concerning one from the UK is that the higher transmission of the Delta was evident, but they were concerned about the severity, and that was especially true in the naive or unvaccinated population. So there's an even greater need for you to get vaccinated with the variant, the Delta, moving around. While you might have thought with the old classical COVID, wasn't a big deal, now the B117, or the so-called Alpha now, we told you that's even more concerning, and this one's even more concerning if you have not been vaccinated at all. So the vaccine seems to be holding off the severe consequences, and 2 doses definitely will decrease the symptomatology and the transmission. So more reasons, if you haven't been vaccinated, get vaccinated. And if you have been vaccinated, when your turn comes, make sure you get your second dose. So we'll all be protected, and we can look forward for a better summer and fall.
Thanks, everyone.
Thank you.